What has been the general reception to the strategy's release?
You know, we've been very pleased with the reaction. Most people have been very happy. I think people have been craving a strategy for a long time. I think the community feels rightfully like it's theirs. And so I think that many people feel like they have ownership, which is very gratifying.
What has your personal, feeling been like after working with the community for a year and then working with the team on the development of it? Do you feel that you really were able to address many of the concerns that you felt in the community?
You know, when I got the job, quite frankly, I felt like my whole job was to manage expectations because there's so much we need to do and no way to please everybody. But I felt like the real challenge was to set some clear priorities that give us a vision for going forward. Not to solve everything, but say, what are the top priorities? And I think we've done that, and I feel pretty good about it. Clearly, it's professionally just the opportunity of a lifetime. And I just feel just really proud that the administration enabled us to put out a strategy like this. You know, we working in HIV, we deal with tough issues, but everybody was very, on the whole team was really with the idea that we need to find the best evidence and go in the path forward that the evidence tells us we need to do. So.
What was the president's reaction to meeting the community, or your interpretation of how he felt that evening at the White House?
I think he gets energized by dealing with everyday Americans. You know, he has so many challenges, and first I'd say he didn't have to do this reception. That when we're dealing with so many crises, it would have been easy to say, I don't have time for this. But I think his presence showed that he's very committed to this issue. But I also think that he really enjoys meeting with people and sort of getting out of the bubble, as they call it, and engaging directly with people. Clearly, it was an electric night. And so I think that how could he not feed off just the positive energy from everybody that was present?
I guess, to that question, there are a number of people in the White House and the administration living with HIV, and this is sort of an unprecedented time between the number of people on, in the organization, but also having a reception of that nature. Is this a historic moment for AIDS in America? I mean, it obviously is on the one hand, but it just seems like there's never been a better time for us to really tackle this problem, given the team.
I don't know what's been done in the past, so I think I always want to be cautious about calling anything that we do historic. But I do think that we have a commitment to involving people with HIV, both staff, but our Presidential Advisory Council has many people with HIV. But also, as I think we've demonstrated, we're committed to working with the community. But again, it's a collective opportunity for all of us. This isn't about the Obama administration as much as it's about the country moving forward together. And even in the strategy, this isn't a federal strategy, it's a national strategy. So hopefully lots of people will see what their role can be in helping us move forward.
Pretty much the only criticism I've heard of the strategy is not being aggressive enough in terms of its goal in reducing new infections. But given that we haven't been able to flatline infection rate for 30 years, doesn't 25% reduction, that feels pretty aggressive if you look at it from a different angle.
Yeah, I actually do believe that 25% is both realistic but also quite aggressive. As I said at the press conference, I wish we could set a goal for 50% or 75% over the next 5 years and believe that we could realistically get there. But I also don't believe it helps anybody to set a really high goal that we don't even come close to achieving. But what I think is new is a clear focus on how we're going to lower incidence, and even just laying out the stark reality that we're facing right now, just to set a baseline. If we don't meet 25%, we could still make major progress, and that's, to me, more important, that we show that we're making significant progress more than whatever the number is.
In the strategy, it's designed to sort of have the focus of, the combined efforts of state, federal, and local health organizations. How will that be monitored? I mean, what will that really look like as you roll it out? Is there a team of people that will literally communicate directly with state health departments and local health organizations, or how will that tactically work?
Well, I think with everything with the strategy, there's multiple layers that are responsible. So when we release the strategy, the President released a presidential memorandum directing executive agencies to take action. So in particular, Health and Human Services is going to come up with an operational plan that's going to pull together all the things that CDC, CMS, FDA, HRSA, all the various agencies are going to do. And I think that can flesh it out because they're the ones that directly fund state and local health departments. But also, PACHA has a very significant role both in supporting the implementation, but monitoring the implementation, but even community-based groups. In our federal system, at the federal level, we don't tell states what to do. but hopefully we've given a vision that they can see what their role is. But hopefully people will talk to state officials and local elected officials and say, you need to come up with your own plan for implementing this strategy.
Will there be any kind of reporting along the way? So let's say a particular state or a particular group is doing very well at implementing the strategy. Is there a plan to highlight their work and share best practices with other states or other areas that might not be as effective?
I think we need to think about those types of activities that would make sense. We have committed to a new level of reporting. So in the presidential memorandum, he directed me and my office, the Office of National AIDS Policy, to report to him annually on our progress. And so for me to develop this report, we're going to be relying on reports from all the departments and agencies across the government. So there will be this new level of reporting. But what you just suggested is great, because it's not just about sort of a cold, what's our progress in meeting these metrics. When there are good lessons, we want to make sure people can learn from other people's successes and build on their work.
The memorandum calls for some reports within 150 days. Do we get to see those reports, or is that all internal process?
I think we'll have to figure out how to disseminate that. We'll have to see what comes in. I think we've tried to be very transparent, and I think it's likely that we will present them, or it's possible, for example, that the reports we get might not be the most understandable for people, but I think you can imagine that we will be reporting to the community on what we get at a minimum.
Gotcha. Appropriations funding, how will that come to bear on this in the future? Right now, obviously, given the economic environment, it's very tough, and the community is very appreciative of the step that's been taken towards resolving the ADAP crisis, and of course we still have the need, but it's like everything. There's a lot of need, but there's also a real economic nightmare going on. So could we hope for additional funding down the line, maybe after the election?
Right, well, I would say a couple things. One, when President Obama came into office, we had flat funded HIV prevention for about a decade. We've increased HIV prevention in our last two budgets. And we announced new prevention funding through the Affordable Care Act's Prevention and Public Health Fund. Now everybody will say, we need more money, but I think we're showing in these tight, difficult times that we're prioritizing HIV, and you can expect that to continue. Similar things have happened on the care side through the Ryan White program and others. Certainly we need to recognize the very significant resources we're bringing into the care system through the Affordable Care Act. So I think we're very committed. The other thing is that the presidential memorandum directs the executive agencies to ensure that as they're developing their budget proposals, that they're looking at the recommendations and the priorities of the strategy so that their budgets reflect the priorities in the strategy.
And so also I'm assuming that those reports will take into consideration that healthcare reform, which is going to help enormously with the needs of the HIV community, doesn't kick in until 2014. So it might look like two different worlds between now and 2014 and then after 2014.
Right, and I think even directly in this strategy, we've been very clear that we need to bridge the gap, that even in 2014, the Affordable Care Act won't solve every problem, but it will make a lot of other problems easier. It'll give us breathing room to think anew about what we need from the Ryan White program, for example. We certainly expect that the Ryan White program will continue after health reform is implemented. But in the short term, we have some challenges. But I would also say these aren't challenges that are for the federal government alone to solve. There's a role for states and local governments, private funders, community-based organizations.
What can the community do to support the strategy?
I think that we've laid out a vision, and I think a lot of people can look at the strategy and say, well, what's my role in this? And I don't think people should sit back and wait for me to tell them what to do. I think they should look at the strategy and say how they can help. We hope that a lot of activity takes place at the local level and the state level to really move us forward.
Mm-hmm. And legislation, do we need new and sort of very specific legislation to secure some of the ideas that we've talked about that are related to the National AIDS Strategy? Is that something that the community should also be focusing on?
Right.
Really calling their local leaders and...
Well, certainly, and you earlier mentioned the budget challenges, and certainly we committed to annual reporting, and part of this, one of the things we said we need to do is we need better reporting so we just know what progress we're making, but we've sustained an emergency response for almost 30 years now. And to keep it going for another 30 years, we need to keep the American public engaged. And so I think there's a role for community keeping both the public but also the Congress engaged. Every member of Congress is hit up from a lot of needy groups. And why is it that they should keep HIV on the top of our agenda? And I think the community has an important role in doing that. But in addition to funding, there's other policy issues that we think the Congress could take a look at. Some of the issues we dealt with in the strategy relate to laws that were passed at different times, and want to make sure that the current policies we have in place support the best evidence-based practices, and I think there's a role for Congress to take a look at some of those issues.
I've been asked, is there an emphasis in particular on, focusing on treatment or prevention, or, is there a, when you read the strategy, it addresses actually so many things. But would you say that there's any sort of particular emphasis in the strategy?
As we've heard at this conference, that where there's a blurring of the lines between prevention and treatment. I think they're all important. I would say, though, that certainly in the area of HIV incidence and the steps we need to take to increase our prevention effort is probably the area where I think we're sort of giving the most forceful vision of what we need to do. The emphasis on focusing on the communities at greatest risk, the emphasis on really scaling up the evidence-based practices and being willing to say that, some of the things we're currently funding, maybe the evidence isn't so strong. So in a time of scarce resources, we really need to focus on the evidence-based practices. But I'd also say the issue of reducing health disparities. My experience has been that we've talked about health disparities for many years. Researchers have documented. So my starting point is I know that these disparities exist, and we need to make major strides in moving forward. But the way we do that is we improve our prevention effort. We get people into care. So to some extent, they all sort of blend together. We have one of the best surveillance systems in the world, but it's still under stress. I mentioned that prevention had been flat funded. As we look at prevention priorities going forward, we think we need to continue to invest in our surveillance systems to make sure it gives us the best data possible. As part of the investments we announced as far as the Affordable Care Act, we mentioned $30 million of new funding. Some of that's going to support the surveillance system. But surveillance on a whole is really about just counting the number of cases. But when we deal with some of the populations of the HIV community, gay men, for example, where they represent 2% of the U.S. population, our surveillance system on its own doesn't tell us everything we need to know about what's going on with gay men. So some of the things we need to do are make new investments in behavioral surveillance and other things that allow us to look at smaller samples of the population to learn things. And I think we're committed to going forward. Now, your comments about testing, I would say, I think the strategy is pretty strong that we believe testing is very important. But sometimes I think people miss a point if they think about testing as about the numbers. To me, testing is about not the number of tests we do, it's the number of positives we identify. And so I think as we go forward, we do want to routinize testing. Everybody should know their HIV status. When they go in for medical care, it should be routinely offered. But as far as some populations, communities need to be tested more regularly than others, and I think we need to expand our focus on that. Again, we have limited resources. We can't pretend that we could offer HIV tests multiple times a year to everybody in the country. But maybe for some populations at high risk, maybe that's warranted. And so the strategy is also not about me or the White House deciding all these tough policy issues. I think we've set a direction. We have a lot of expertise at CDC and elsewhere that are going to grapple with these issues. And the community does have a job to push, but they also shouldn't expect that every question is going to be answered within the first 150 days. But I think we have a direction going forward, and I think you'll see renewed leadership from HRSA, CDC, the many agencies that work in HIV. We believe that there's more to be gained by just being honest about where we are. Perhaps at the beginning of the epidemic, and this isn't just about gay men, but just for example, this country has moved a long way in the last 30 years in how it deals with and understands gay and bisexual men. We probably couldn't have had the honest conversation 30 years ago that we can have today, and really believe that if people understand that gay men are driving this epidemic, we can still expect the general population to care about them. And I think we've come a long way. The strategy cites data from the Kaiser Family Foundation that says that roughly half of people in our country, more than 300 million people, know someone living with HIV. That's both a reminder of the extent that HIV has permeated society, but it's also something that's hopeful, because we know that when people individually know people with HIV, they're more committed to the fight. So, I understand the concerns, but I think there's just more to be gained by just being honest about the challenges we face and addressing them in a direct way.